Welcome to our weekly For Your Pet segment. Tonight, Dr. Jeremy Varga is joining us from Austin Veterinary Diagnostic Hospital. And you brought a special guest, Tejas.
Sure. So this is a beautiful cat.
And tonight we're going to talk about teeth. We're going to talk about dental disease, which is very important. So I'm always very active with getting my dog to get her teeth cleaned. And
Good.
A lot of people are a little hesitant saying, oh, I don't want to put my dog or cat under anesthesia, but tell me exactly what it is and then why it's so important.
Sure. So the reason why I brought Tejas is he came in on a routine physical exam, and we found that he has quite a bit of tartar on his teeth, and so that's why he's here with us for the segment. He has actually a condition in his mouth, not just tartar, but we have a video going right now. This is of a cat's mouth. Now, a cat has 30 teeth. So Tejas has 30 teeth. But the tartar that's on his teeth is actually infection. It's bacteria that appears brown, but that causes inflammation. It leads to all these scary terms like periodontal disease, which is painful and can cause them to lose their teeth.
Well, and a lot of people at home may not even be sold on that, going, okay, well, your cat's, like when my dog had a filling and also had to have her teeth cleaned, people were saying, really, it's a dog.
Sure.
But there's other serious problems that can develop.
You're exactly right. So it's not just the teeth. In fact, cats and dogs aren't vain. They don't really care about cosmetics. It's that dental disease can cause pain, but it can also cause other health problems. In cats and dogs, they can develop heart disease. In cats, especially kidney disease, and in dogs, liver disease because of their teeth.
And also, another concern I've heard from people when I've tried to encourage them to do this is they say, oh, the anesthesia could be dangerous, and my position was, I feel like cleaning the teeth is is a better option.
Absolutely.
And the end result, what could happen if you don't do it?
Anesthesia is a concern for any veterinarian, and it should be for any owner. Now, these days, fortunately, we have safe options, and we have good monitoring equipment when we put our pets under anesthesia. For a dental procedure, they do have to be anesthetized, so they have to be asleep. There's not a dog or cat that I know of that will let us clean under the gum line.
Like we're looking at right now. There's no way.
They have to be intubated to do that. Now, the other reason is we don't want water from, in this case, an ultrasonic scalar that uses water. We don't want that water going down in their trachea and in their lungs, and so that's the other reason they have them intubated. You
have the tube in the mouth. So tell me exactly, we're looking at video of the procedure. How is it done?
It's done exactly the same way as it is when we go to the hygienist. So our teeth are scaled with either hand instruments or, in that case, an ultrasonic scalar. Then they're polished, and so the polishing gets rid of any additional tartar. It also takes care of any imperfections on the teeth to prevent future buildup of that tartar, which, again, is infection on the teeth.
And at least you don't ask questions of the pet when they can't answer because their mouth is open like they do.
They don't mumble some random answer.
But also, from the procedure, what can pet owners expect after the procedure when you bring your pet home?
Sure. So after anesthesia, there's going to be a period of time where they're a little bit hungover. I mean, that's just the reality of it. It happens to us if we ever have anesthesia, too. So usually what we want is a quiet evening after a procedure like that. And those are day procedures. They're dropped off in the morning and they're picked up in the afternoon. Now, we're quiet for that evening, and then the next day, usually they're back to normal.
Can we see Tejas's mouth?
Sure.
He should have some pearly whites, or he or she?
Well, he's here because he's scheduled to have his teeth cleaned. And so if we can zoom in, this is the kind of thing that you're going to have to do as a pet owner. You want to see all that tartar that's in the back right there, all that brown stuff, that is infection in his mouth. And so the owners are going to schedule to have his teeth cleaned.
And then you need to keep up and clean your pet's teeth.
Exactly right. So there's preventative maintenance at home. I would recommend everybody brush their dog or cat's teeth every day. Please do it, because you can prolong the period of time between professional cleanings if you brush. There are rinses available. There are chewable antiseptics that we can give dogs and cats.
It's hard to track them down and do it, but you really should.
You should. Now, you definitely don't want to use human toothpaste. That's meant to be spit out. So if you use it in a dog or cat, they're going to want to swallow it, and it will make them sick.
Well, we're out of time this week. This is some great information. We appreciate you bringing Tejas. So cute.
It's a large subject, and maybe we can revisit it
I'm
in the
sure
future.
we can. Maybe we can do the actual brushing out here. But
Sure.
next week, tell me what you're talking about.
We're talking about snake bites, and so Dr. Barrett Donop's going to have a rattlesnake on here with
No,
us.
I already told you
I'm
there's
just
no way I
kidding.
wouldn't
I'm
let you
just
in the
kidding.
studio.
But it's that time of year that we start seeing
Yeah.
snake bites, so Dr. Donop's going to come talk about that next week.
All right, and we want to let everyone else know if you have any information, if you have questions, or you want to email us, just send us an email at fox7foryourpet@gmail.com.